She's constantly reminding us of our collective responsibility to deliver this application. Honorable Chief Minister, the PressTrack initiative.
The greatest things that we could have been doing. So the pregnancy registration and service tracking application. Otherwise, and I hope that we all leave from here to call the Cumbra app, because all this PressTrack, now in the project link, because truly now the Cumbra app. And since I am still laughing on the referral, we should probably automate the referral such that the decision is not being made by the humans there whether they refer a teenage pregnancy or not. That should go through the system. Maybe focus on why I'm truly here, which is to speak about the opportunity that we have. I'm not here to speak about the app. And before I do that, when I started at DSTI 6 years ago, there were two things that I thought would transform this country. Many things, but two that I really thought would transform. One of them everybody knows, and everybody in here has used. That's the SMS results checker. There is no household in this country, none, for which somebody has not been able to check their results of their child. None. The most important application is PressTrack. And I think the impact of PressTrack, and I think that imagination itself will stop at what it ultimately could do when we embrace it. So this Cobra app here, now you get for me as Dr. Demi say, made a no salon past how people let me not know salon. And there are a couple of reasons why this is true. One is policy. This idea did not just start out of a vacuum. In 2019, we launched the National Innovation and Digital Strategy. In the National Innovation and Digital Strategy, it speaks about using technology, fourth industrial revolution, to drive healthcare improvements. That same National Innovation and Digital Strategy speaks about what they call hybrid technologies, online, offline. And this online, offline capability that we have innovated as a team, which is going to make this app to be functional everywhere out of the country, is derived from a 10-year vision, a 10-year strategy that we as a nation launched in 2019. Supported by no less a person than His Excellency, the National Innovation and Digital Strategy. There is no day when I was CIO when I'll go to the office of His Excellency, I can go naked to and plenty time. When you in our office, I can break and lunch, so that's why I can go naked. But no day when they say there's no free lunch. Really, is that there's no day which His Excellency wouldn't say, you know, we really need a technology to help with this maternal mortality business. You know, we really need to use mobile phones to see how we can address where pregnancies are high risk. No day. So we live in a country where the fundamental is true, that there is political leadership driven by a vision and strategy that is well documented, well publicized, and used as an international standard. Untested PressTrack, consulted on the vote, if you don't work on PressTrack in any shape or form, put your hand up. This is the point I'm trying to get beyond. Have been able to contribute technically to the development of this solution. So the team at DSTI, the team at Ministry of Health, the teams, the nurses, the people in the fields. I have gone to many of the PHUs myself, because the team forces all of us to go and be user testers. And we've all done that. That technical leadership, driven by the doctors and the team here, is why I'm absolutely excited about the future of this solution. Meaning, if you are in MOH, you should not be fighting about whether your DSTI should not be like, oh, now we build this app here, so now we want to wait for users. We are one government. And I think the solution that we have here today demonstrates what the power of one government can be. That when the ministers, whether it was Austin, anywhere he is, he said he'll be in Leone 3 years ago. He's in Leone or somewhere, and he's talking about PressTrack. He's sending me a message right there. It's Tom, Doctor, wherever, and engage on it. That is what we mean. We as Sierra Leoneans, we, the people, us, working across government, must be able to share knowledge, must be able to share technical capacity, and must be able to work together to deliver on solutions that will transform lives. For that great level of collaboration. And the thing is, it's not I want to see what's in their supplies, and I want to be able to give you the feedback. Now, all of this, the technical capacity, the political will also not help us to get where we want to go for the transformation. And that's why I'm super excited that at the granular level, the ministry has a digital health policy, you've rolled out the electronic medical record system. The Ministry of Communication is here, connectivity is important. Yes, we have online, offline, but she's not here because she's forced to, because she understands that the responsibility that we all have is to ensure that connectivity exists across our facilities. So as you solarize all of your PHUs, I'm sure you should be dropping something into her air to make sure that there are cell towers available close to all of your PHUs so you don't have to use the offline solutions all the time. Mobile penetration is net about 96% across population currently. So that connectivity, mobile penetration are really important. The expansion, continuation, and expansion of the free healthcare policy. And for me, there's something really inspiring happening in our country. I'm sorry that I dropped in a little bit late because I was out at Pintamani. His Excellency, the President, is signing today the abolition, the child marriage bill that will abolish all forms of child marriage, all the loopholes that existed, all the laws in making sure that our children can be children. And when that is happening at the same time, we are here launching the platform to ensure that those who are legally allowed to get pregnant, that they can deliver safely. So that radical inclusion, that transformation that the First Lady has driven and taken leadership on that is happening, is a wonderful and beautiful thing in our country. And we must never forget to appreciate the transformation that is happening in our lifetimes in front of our eyes. Those numbers going down did not go down by magic. You don't just go from 717 to 443. It is based on and driven by these intentional acts, these intentional policies, and these interventions that you have. So a little bit on PressTrack. One of the things that I love about PressTrack is that they pull the no, not the again no. Because you know, you get login. If you not be known that your responsibility for no, and you have the accountability that's embedded in there. Because there's a tracker for say, did you see this person? It's still pending. So you have to take action. Inaction is no longer an excuse. And in the maternal health realm, people speak about the 3 delays. I thought it was 5 delays, but I was told it was 3 delays. We can combine the delays, you know? What this app does is it removes that delay, even that compressive we don't go away in number delay. We can push information to them so that they know that they have to go. Delay so they don't get access anymore. Because we knew when last they came, we will use this technology to limit that delay. You know, with all the high risk things that were there, and they told you that the solutions are smart, our healthcare professionals are really technical and trained. But sometimes we make delays in taking critical decisions in service provision. Those red flags are there to make sure that the human element, wait for them make it delay small, not good, People always think that technology will replace humans. Never. Other technologies, the human relationship. Mobile phones are our relationships. Computers did it. PressTrack, not going to take the work that the nurse in their hand. PressTrack is there to help the nurses be better nurses. PressTrack is there to help the health providers, the physicians, to be better physicians. Make those decisions. And the most beautiful referral, which is why I gave the feedback about automating some of those. I love humans. Humans are great. Things like machines. Machines, you know, don't forget. And I think when we are able to have these tasks and automate referral, then there is no delay. Because if you know, say, as the DSTI fellow said, obviously, it's pre-eclampsia. You don't need to make a decision on it. It should be an automatic referral. Somebody high up in the chain needs to know. And I think when we're able to remove these delays through technology, by ensuring that technology works with us humans, we are going to, as Dr. Demby said, we should bend the curve down. It's too linear. Before mass, the curve may go down. That is what will happen when we are able to roll out these solutions. Those dashboards, I also have logins. So Dr. Demby, I will be looking at those ones. I will tell President Bio, we'll give him a login, and he will be there looking at why is this happening like this. So I want you to know that when they text me, like President Bio can text me, then me say they text me. You know, I usually say hashtag we will deliver. It's very appropriate now because they deliver then one who make me only to keep them, may they all deliver. But I also speak about radical inclusion and the power of radical inclusion, that wherever you are, no matter whether you get money or not, if you get belly and you right, your reproductive right, your safe reproductive health is your right. That anywhere across this country, we should be able to ensure that you survive, that when you're pregnant, that you have access to care, because that is a responsibility government has taken to give you free health care. That's what radical inclusion is. And when we say we will deliver, it's that we will put all of these things in place, literally, so that you will go deliver the Peking. But it really means that we all have the responsibility to ensure that we will work together to reduce these numbers. So it's wonderful to see that in 2000 we're 1682, in 2018 we're 717, in 2020 we're 443 out of 100,000, and that we have a goal. The ministry's goal is 70. Well, I'm sorry. That needs to be updated. It may have been that it's 70 by 2030, but your challenge is that you have to be zero preventable maternal deaths by 2038. That's the order. That's the task that we all have. And you know, when I complete the sentence, I believe we can do it because together we will deliver. Because together we will deliver. 0 by 2038. And it's important that as a people, we understand that we can do it. It is important as a people we understand that the decision makers across the entire chain, from that person we get belly to the one we get belly, all man get responsibility for make sure say we work together for make that pikin they may deliver safely. May the pikin not die, may the mama not die. You know, things that happen that will transform the future of our individual destinies, our community, and our country. I believe that today is one of those days. And so I want to support and stand with Dr. Demby when he said that in 18 months, we will ensure that PressTrack is all over the country. Why do I believe that? It's because together, absolutely. I have no doubt in everybody's ability and the ministry's ability to ensure that together we will deliver in ensuring the PressTrack is all over this country, and by 2038 there will be 0 preventable maternal deaths that we have. So I want to use this opportunity very humbly today to launch one of the most amazing and inspiring and high impact potential solutions. The Kumbra, what would they call PressTrack? I want to have you all join me in applauding the team who's done all this great work and to wish them every success. I also want to use this family planning keke, which the team has been able to develop together again with the Ministry of Health. Round of applause. Before I sit down, Auntie Mary and her team did a wonderful job, and they had that song about we will save more babies. So we'll sing it. But before we all stand and sing that song about saving more babies, I had a question for my colleagues who were sitting over there. The song originally said that I love to be a midwife, and I asked if a man, is it a mid husband? I was told as a midwife. Anyway, so I'm happy, I love midwives. When I sing it, I don't have to say I'll be a mid husband. So at this point, we will invite Auntie Mary and the team again. Let everybody stand and let's sing about we'll save more babies.
Oh, I want to be a midwife. Oh, I want to be a midwife. Oh, I want to be a midwife. There is something I love to be. There is something I love to do. 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 Oh, I love to catch my babies. Oh, I want to catch my babies. Oh, I want to catch my babies. There is something I love to do. 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 Oh, I want to save my mothers. Oh, I want to save my mothers. Oh, I want to save my mothers. There is something I love to do.
You don't capture your phone. Action! Step back. 10, 4.